Hi everyone, in this video I am going to explain radius bone, its side determination and its important feature. Radius is long bone of upper limb, it is lateral bone of forearm. Above it articulates with capitulum to form part of elbow joint and it also articulates with radial notch of ulna to form proximal radio-ulnar joint. This one is radial notch of ulna and this is capitulum of humerus. And inferiorly it articulate with the head of ulna to form a distal radial ulnar joint and it also articulate with scaphoid and lunate bone. It consists of three parts. This one is its upper end. This long part is called as shaft of radius and this lowest part is called as its lower part. Let us discuss all of its part one by one. This is the anterior surface of radius and this one is posterior surface of radius. Its upper end consists of head. This is head of radius. This head is surrounded by hyaline cartilage and from above it is concave and this concave surface articulate with capitulum of humerus to form part of elbow joint and medially it articulate with radial notch of ulna to form proximal radio-ulnar joint. Below the head there is neck. This one is neck of radius. This neck is surrounded by annular ligament. Both head and neck of radius are free of capsular attachment. There is no capsule attached to head and neck. Its upper end also consists of a tuberosity. This tuberosity is called as radial tuberosity. Its lower end consists of five surfaces. This one is its anterior surface. Its anterior surface consists of prominent ridges. These are prominent ridges. And this one is lateral surface of lower end. This lateral surface you can see it is prolonged downward. This downward projection is called as styloid process of radius. This styloid process is present on its lateral side. This one is medial surface. This medial surface consists of a notch which is called as ulnar notch of radius because it articulates with head of ulna. This one is posterior surface of lower end. It consists of 1 to 4 grooves. These are grooves which are present on its posterior surface and tubercle. This is called as dorsal listed tubercle. This is inferior surface of lower end of radius. It consists of two areas. This quadrilateral area articulate with lunate bone and this triangular area. This triangular area articulate with scaphoid bone. The shaft of radius consists of three borders and three surfaces. This anterior border starts from radial tuberosity. Its first part is oblique and its second part is vertical and then its lower part is crescent like. This is its lower part. Its second border is medial border which is also called as anterocious border because it is articulated with anterocious membrane. This medial border starts from medial end of radial tuberosity then move downward and at the end it become continuous with posterior surface of ulnar notch of radius. Its third and last border is its posterior border. This is posterior border. This posterior border is mirror image of its anterior border. This one is its posterior border. And it consists of three surfaces. This one is its anterior surface. This anterior surface is present between anterior border and medial border. This anterior surface consists of a nutrient foramen. This one is the lateral surface of radius. This lateral surface is present between anterior border and posterior border. And this last surface is called as its posterior surface. This posterior surface is present between posterior and medial border. And after knowing all of its features, it is very easy to identify sides of radius bone. Its upper end can be recognized by its head and also from this tuberosity, and its lower end can be recognized by this styloid process and on posterior surface from these tubercle and grooves, and its anterior surface you can recognize from this radial tuberosity above and from these prominent ridges at the lower end. Its posterior surface you can recognize from these grooves and dorsal list as tubercle. The lateral surface can be easily recognized by this downward prolonged styloid process, and its median surface you can recognize because its median surface is very sharp. That's all about radius bone, and I also have provided a link for practice MCQ in the description. And if you like my video, then please subscribe to my channel.